What does this avocado and this cervix have to do with each other? Well, I got to tell you that it is not that this tastes good with chips. It is all about cervical ripening. So today we're going to talk about cervical ripening, what it is, how it happens, how you can make it happen on your own. And I've got to say, after seeing thousands of patients in labor, people did not understand this, but it is such an important part of the labor process. I'm really glad that you guys are here. Let's talk about your cervix and how it gets ripened. If you're thinking about your ripened cervix, it is likely that you are in your third trimester. I actually have a whole third trimester checklist that I'm going to link to down below. It is going to be so helpful. It has so many helpful things, including how to do kick counts, which if you're past 27 weeks, you need to be doing kick counts. So grab it down below. Okay. In the medical profession, we love our fruit analogies. And this one is about, a mango, an avocado. The reality is that your cervix needs to get soft before it will really open up. And just like this avocado, this one's hard. This is not going to be having guacamole today. And so your cervix is like that. It needs to soften up before it's going to be ready for labor. Now, this is your cervix. It's the bottom of your uterus. It's not a separate thing. It's just the bottom of your uterus. It's what we check to see how far along you are in labor. And as you get closer to your due date, your body normally releases hormones that just helps it to soften a little bit. It's just helping it get ready for labor. And a lot of times those Braxton Hicks contractions that you're feeling may not open your cervix, but they're going to start to soften it. As a nurse, sometimes you go in to check somebody and their cervix is hard, like a car tire. And sometimes you go in to check somebody and their cervix is soft, like a brie. And so that shows it is a ripened cervix versus the hard car tire analogy. So how do you get this cervix to ripen? It is a great question. Now, there's a lot of things that you can't do. You can't make your body secrete those hormones. There are a few things that you can do that has been shown to help this cervix soften, though. I actually have a whole video on helping your cervix to dilate. I'm going to link it down below. But it's things like dates, primrose oil, sex, pumping. They can sometimes help your cervix to soften, although these are things that you do not want to try until closer to 36 or 37 weeks of pregnancy. And the good thing to know about those things is it is not a one and done thing. Most of those are things that you need to do daily, some of them, or a few times a week in order to really make a difference in your cervix. In that video and the post that accompanies it, I'm talking about real studies where they compared people who tried those things versus people who did not try those things. And it did help their cervix to soften a little bit. Now, the main thing that has been proven to soften your cervix are prostaglandins. So things like Cytotec or misoprostol, Cervidil, or Prostin gel. And those are things that we place near your cervix to help it soften before we put you into labor. And these are things that we do in the hospital. Remember, to go into labor, your baby secretes something that says, hey, I'm done. I'm ready to come out. My lungs are ready. Your uterus secretes something that says, hey, this baby's getting too big. We need to get it out of our body before it won't fit through our pelvis. And your brain is saying something like, yeah, we're in a safe place. Let's go into labor. So all of those things have to agree. And I am here to tell you that if you think you can push yourself into labor, that is not true. I know that there's people on social media who will say I did XYZ and it put me into labor, but their body just agreed that it was time to go into labor. So please don't be stressing yourself out as though that was something you control, because I'm here to tell you it is not something you control. And I would take more naps and eat more frozen yogurt rather than putting myself through the stress that I controlled that, even though I totally thought that I could when I was pregnant. So I see you if you think you can control it, but stop thinking that you can. It'll help you have a better pregnancy. So when we give you those medications in the hospital, the misoprostol, Cervidil, or Prostin gel, it just helps your cervix to soften. If you come in for an induction, either elective or medically necessary induction, we give you those things before you hit 3 centimeters. Usually once you've hit 3 centimeters, it shows that your cervix is softened and we're ready to use Pitocin, which is given IV. Now, how long does it take your cervix to soften or ripen up? And it really depends. Some people really only need 1 dose of those things and suddenly their cervix is totally ready. And I'm here to say that if you go to the doctor's office today and your cervix is hard like a rock and you feel like labor's never going to happen, tomorrow with a few contractions, you might start to soften that cervix. It could be 1 or 2 centimeters tomorrow. So it doesn't mean that whatever your cervix is right now is going to stay that way, but also we don't know how long it's going to take for these medications in the hospital to really help your cervix to ripen. And we can actually give up to like 8 doses of those medications. Usually when we get to 8, we try something different if it's really important, but we can try a few different things to see what works for your body. And if you're looking for more information on being induced in the hospital, I 100% recommend a birth class that covers induction. There are so many birth classes that gloss over it, mostly because the people who are teaching the birth class don't know much about induction. But the one that I recommend, it totally goes over induction. It has a whole chapter, a whole induction checklist. Definitely check it out so you can know more about an induction of labor. And like I said before, if you want to know the things that you can be doing to help that cervix soften, again, these things will not likely put you into labor, but they can help your cervix soften. I'm going to link that video up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. Often with some great fruit analogies. Is an avocado a fruit? I think it is. I don't know. I don't know anymore, guys.